50 pounds is a lot easier for me to walk upstairs now than 50 pounds ago. And for my top weight, I'm 78 pounds. So
woo.
That's a lot of achievement.
That's a huge achievement.
Yeah.
How are you doing?
I'm doing okay. Drink your water, everybody. Drink your water, for sure. I got dehydrated. Spent a little time in the ER and it wasn't good.
You did?
Drink your water. I've lost 15 so far.
Okay, that's good. That's good.
Yeah.
Do you find that with 15 gone, things are easier for you? You know?
Yeah.
How?
Well, I'm gonna have to go shopping soon.
Oh, he just cringed.
That's the happy downside. No, I can. My feet don't hurt. My knee doesn't hurt. My shoulder doesn't hurt. Yeah, I feel my head is clear. I don't know if that's.
Yeah.
I feel
Alive?
Like you're detoxified or something.
I guess.
Right?
I'm not exactly sure what it is. I don't feel I feel good. Even though I've,
You've got energy. You've got some energy.
I got some energy. Yeah. Yeah, I feel good.
I've lost 50 pounds already, but more important, I don't have to use the CPAP anymore.
Yes.
Oh, wow. So
That's wonderful.
Is there anything you take for gas pain? Yeah, can we take gas X?
Do you know, gas X, they're all drugs that induces motility. So it does tend to cause spasms. I mean, you can try it, it's not going to hurt you, but it may give you spasms and colic.
There's another one out there that it's not only for the gas, but it's for the odor in your gas.
Oh, the Beano?
No, it's called Devrom. D-E-V-R-O-M.
I have the most toxic gas. It's ridiculous. No, it never used to be this bad, and after the surgery, it's like it can clear like a city or something. What is it called? Devrom?
Devrom.
Mine's not that.
One other thing you can try is mint oil or peppermint water.
Okay.
Just put a little bit of peppermint in your water.
You mean extract and then?
Extracts.
I'm 2 months out. I had or it's like almost like 2.5 months out.
What'd you have?
And I had the bypass.
Okay.
But I had trouble with like social gatherings.
Why?
Just because all my friends just wanted to like, let's go out and eat. Let's go like.
So?
Go.
Go.
I go.
Go.
Like, well, then I also was like, the whole reason why I got the bypass instead of the sleeve is that I wanted dumping syndrome. Because I knew if I could eat the bad foods, then I would eat it.
But you know what?
I don't get dumping.
But you've got a tool. You've got a tool.
Yeah,
and you know what? You
still
now
buy
have to
the
learn
plate
how
and
to
not
use
eat
the
it.
tool. And you can go out. We've been out to lunch together. And
Yeah.
you just look at the menu, and number one, you make choices. You ask how the food is cooked. You ask to have it cooked how you want it. And you ask for a box when it comes and put however much you don't want to eat in the box and take it home.
Right. Remember, it's a spectrum, right? It is a spectrum of symptoms.
And
Okay, that's why it's called a syndrome.
It may not happen this time, but if you do it again, it might.
But 20% don't get dumping. And that's the other thing. You have to remember when we talk about this, dumping is a spectrum. And it happens 80%, not 100%. So there are some patients that just don't get it.
And those are the patients that
And
you
got to
have
be
very,
careful now.
very,
because
very
now if that is
careful.
you got to kind of be cognizant. Which doesn't mean that you shouldn't socialize. So when you go
I
there...
feel like I eat more than I should right now. But I'm working out a lot, so I'm still losing weight. I
But
go to the gym
you
5
need
days a
to
week.
still make the correct food choices, and that's really good. But like I was talking earlier, you can, especially if you know, say you're going to a particular restaurant, it's so convenient now that you can pull up the restaurant website and make a decision what you're going to eat before you get there. You know, I always look for things like lettuce wraps and, probably safe stuff, lettuce wraps that I can actually eat my chicken and a little bit of rice and stuff within the lettuce wrap. But you can eat, you can go and you can eat, and you need to learn how to socialize And you know what, and your responses to things like that can be, you know what, I'm following the rules that my doctor set forth for me.
Pressure from friends and not family. And it is a big trap. Okay, I can tell you this from the very outset, especially if this other person has had surgery themselves. So they kind of walk the walk, and they're kind of trying to empower
she
you.
tells me I can pretty much eat whatever I want,
Right.
but I'm eating small portions.
Okay, so patients are very different, number one. Second of all, you have to stay true to what you have learned, and your physiology is probably very different. And it's possible that she or this other person in your life that you will meet one day will tell you that I've had this, I've eaten everything, and I smoke a pack, and look at me. I look perfect, no ulcers, and I've lost all the weight I can. We know when you look at the broad studies, picture of hundreds and thousands of patients, that those models don't ultimately fare well. Those who eat everything and they don't keep on track and they don't follow their supplementals and they don't take their proteins, they don't take their vitamins, it eventually will catch us up with them.
It does catch you.
So stay on task.
No,
Okay, so you go out with friends or family, they're eating other things, you choose the better things. If you want to order a margarita and have it later, a sip of it, it's okay. It doesn't have to be exactly how everyone else is doing, but you can definitely do not miss out on these occasions. You will find that psychologically the impact of those are a lot more detrimental. Mm-hmm. And you start to self-isolate yourself, and you go out, have a good time. Yeah, no, you go out.
You go out. You
Right.
go out. Just because you had the surgery doesn't mean you can't live life. And you've got the tool, you've got the knowledge, so you've got the power, and you've got that ability to make the informed choices of what you want to eat and what you want to drink. And that's really it. And so exactly like Dr. Yadegar said, live your life. You know, but know what you need to do portion-wise and that kind of stuff. And that's a hard problem, and a lot of people come across that problem where they feel pressure by outside forces to conform to them.
This could be a session with your college peers who will take drug and tell you to do the same. It's the same thing.
Yeah.
Why is it hard to say? You just
Because
say
you know
no,
what?
thank you. I mean, that's it. Simple.
Because you know what? If to a lot of us, and people can throw rocks at me for saying this, but for a lot of us, food is a drug because it gives us comfort.
Yeah.
And you know what? How do we deal with that comfort or that drug when we can't do that drug like we used to? We do, which boils down to how do we cope with that? How do we cope with the loss of the food and the ability to not eat as much as we would like to eat?
And can you personally talk to her by herself and just say, you know, I love you and you've done terrific. It's just this is my own journey.
Because it is your journey. It's a huge journey.
I would go and just, you know, eat certain foods. And my mom was really supportive, so we would share plates, you know, and we still do. But if you have the money, go to Sizzlers and eat fruit if you want, and that's it, you know. And it doesn't really matter what they say. I mean, this is, you know, this is your life.
This is your
what
choice.
you're gonna be doing. You know, that's what I do. When I get whatever I want, and I give the rest to my boyfriend. It's like you go ahead and eat the food, you know, or he'll take it home or whatever. But you're not gonna change things. It's just choosing healthier, like Liz said, choices.
And you know what? You're not going to change how people are going to react. You're probably not going to change how people are going to react to your surgery. But the bottom line is you have control on how to react to do what you know what you need to do.
I have had a few husbands and wives of the patients who've kind of followed that trend, and it's a challenge. You got to be careful as well. It's not that you can't eat things. I mean, you just have to make sure that things that are not healthy, you have less of, right? So if you are going to have that ice cream, you have one, because dumping is a dose-dependent event. It's not just, you know, if you have a spoonful of a creamy, fatty ice cream with a bypass, you may not dump on that. It's possible. And you have the second spoon, then you will. With the sleeve, it doesn't happen. I mean, I know that you were expressing this event, but with the sleeve, really, typically, you won't get dumping. And so what happens, unless you manage to drink a large volume of sugary fluid that goes through fast, which you will feel very uncomfortable, and that hits the small bowel quickly, and that causes it. But chances of that happening are very remote. So if there are things that you want to have, and you feel that you still have space for it, and you want to have that little bite of a cheesecake, it's okay. It's not those things that get you into trouble. What gets you into trouble is eating consistently unhealthy foods, or making a meal out of a cheesecake and not eating anything else. That's the problem.
He still does his protein. It's basically at home I cook the same way, the same things, but he eats a lot less of it.
Right.
Portion control.
So, but
He's practicing portion control, like she said.
Can you explain
Hi,
dumping and the process of it and what
I'm
happens?
actually
You're a bypass, right?
Can
I'm
I
a
call you
bypass.
this yourself?
Okay. So what happens is that if you have
Yeah, I'll put it in the
food
back.
that's been a
I'll
high
put it in the back.
carbohydrate load
Thanks, I
or
appreciate it.
high
Thank you.
fat,
Take care.
you
Bye.
take it in, it goes through, and basically it's how do I explain it where it's not like all sciencey?
Like allergic reaction?
What is
No,
that?
it's a shift of fluid. There's a shift of fluid, and the fluid gets pulled into the bowel. You get crampy, but really what happens is, I'm going to give you your card so I don't lose it. It's a cross between. I explain it to people. What it feels like is a cross between a hot flash and a panic attack.
It's almost a more panic attack.
Panic attack because
It is.
your heart starts going like this, and my heart goes like this. I get hot and I get crampy, just like, oh my gosh, darn. What did I eat?
And you panic because you're like, oh, how do I make this go away? How do I make this go
Go
away?
away.
And then when you realize what you've done and what it is, you can't make it
You
go
can't,
away.
it has to just go.
And then you start to panic.
It could be, everybody's different. It could be 15 minutes. It could be a half an hour. It could be, some people have it for several hours where they just don't feel well after that's happened. You know?
And not everybody gets the panic or the sweating and stuff like that.
No.
Either, because like I've had stuff, like I was finding eggs and all of a sudden one day I had my egg whites and all of a sudden my stomach was like, this is not going to happen today. Like it was just like 15 minutes later, like it was unhappy with me and I didn't get the sweating and
But
stuff
that's
like
different than
that.
dumping.
But that's an
I haven't
intolerance.
grown
That's
up.
definitely not dumping.
That's different than dumping.
Dumping, I mean, you truly have a physiologic reaction to it. Because
So if that kind of thing happens, just make sure that you go and look at what you eat in, and to make sure that it didn't have like butter or sauces that were rich in fats. Because often with foods, there's a sauce so much more than it is the actual food itself. So that way you're certain that it's not something that you've eaten.
I want to know how you guys chose what you guys did. What went into the process of choosing what you guys did? Me? Everybody.
I'll share mine. Mine was back, in the Stone Age, 8 years ago. They offered two things. They offered a ban, and that wasn't happening for me, and they offered a bypass. Had I probably gone to another doctor, they would have offered a duodenal switch back then, and I can tell you that would never have happened for me. And so I was pretty much set from the time I decided to have bariatric surgery that I was going to do a bypass. That was no option. What about anybody else?
Mine was because you said the band usually loses like 40%, the sleeve usually loses about 50-60%, and the backpass usually loses about 80%.
And I was real big. I was 330 pounds. So.
Yeah, that's the reason why I did but I wanted to optimize my weight loss as much as possible.
Plus I wanted to get it down again. I did this way, because I knew if I could eat the food, I knew I would. So I didn't want to get the sleeve because they don't pay dumping, but I don't pay dumping anyway.
And I chose the sleeve. I wanted the lap band, but I had cancer in my stomach, and I don't know if you're going through Kaiser or what you're going through or whatever. Okay, so Dr. Yadegar talked to me a lot, and so if my cancer came back, it's in the stomach. So I just said, and also with him was, let's get rid of part of the stomach. I wasn't going to do the, what is it?
Bypass.
The bypass, because I know I have to take medication the rest of my life. So I want to still be able to swallow that pill.
That's a part of it too. If you can take what medication,
Yeah.
if you're taking certain medications.
So mine is I mean, the stomach still would have been in there. So it was because of Dr. Yadegar, and I got great results Friday. I don't have cancer in my stomach right now.
Yay!
So Dr. Yadegar checking everywhere, because he checks everything when you're in there. And he shows you a really pretty picture.
Family photos, right?
He shows you what he does, you know, and now I look at the picture as a beautiful picture because my cancer is gone. So that's why I got my sleeve.
But is it normal for like our periods to be worse?
If that continues, the only thing that I can tell is you actually have to go see your primary care.
No, that's a
doctor.
very important point now, especially older patients who kind of are, in their 40s and because of their obesity or thyroid patients didn't have periods and they made the assumption. I'm talking about late 40s.
Mid-40s?
Late 40s. I didn't say, okay.
That hurts.
Didn't it?
Yeah.
Older
Let me be a politician and retract my statement. No, older patients, and I'm not saying old, I said more into their physiology, that when they get into that age where they're not sure, am I coming up through change, or is this because of my thyroid or my obesity? So after you get through weight loss, typically your periods do get heavier, and then you'll become more regular. Now, having said that, if they do continue to be heavy, you do have to get a gynae check because you want to make sure you don't have fibroids or you don't have a polyp in your uterus or your endometrium is not aggressively thickened and they have to maybe take a sample. So do definitely follow
If you've had,
your gynecologist.
Yeah.
if you've gone into a second month and you're still like that, I would be making an appointment to see my doctor or get a referral to a GYN if you can self-refer. If you've got a concern, you really need to just follow up with your primary or get referred to GYN because, it could be, yes, you've had the surgery, but you also coincidentally have just something else going on, So to be able to nail it on the head, it would be best that
And if your gynae checks you over, does an exam and an ultrasound and everything's
do maybe
okay, and a
hormone
hormone
levels.
level check, then you're fine. Don't worry, it will happen.
And anybody who's further than 6 months out, how are you doing? Successes, struggles? Yeah.
Well, I keep plateauing every once in a while, but I've lost 5 pounds since I saw Dr. Yadegar 2 weeks ago.
How long
So
she
it
out?
just comes in spurts,
Mine came in spurts like that.
Altogether, pre-surgery and after surgery, I've lost over 100 pounds.
Wow.
I got the gastric sleeve, because I like food. I taught cooking for 30 years. I enjoy having a little bit of anything that I want.
Mm-hmm.
But, I concentrate on the good stuff first.
Mm-hmm.
But I do every once in a while have...
Do you have a more of an awareness now?
Oh, yes. And I'm still, writing down what I eat and trying to keep
My
it
girl.
in that, at least 1,400 calories.
Uh-huh. And it's important. It's really important to know your calories, to know your protein, portions, absolutely portions. And Dr. Yadegar has alluded to this several times today, is that, people, when you get further out, you get a little lax and you're not measuring your food, and pretty soon that half cup is a 3/4 of a cup, or that quarter cup is a half a cup. It's like, wow, where's that weight coming from? Why am I stalled? And when you start getting to that point and you're further out and you're not seeing anything happen, that's when I really, anybody who comes to me and says, I'm not losing weight, put it down in a journal. Put it down in a journal. And, I truly believe that.
If you hit a plateau, is it okay to go back to like the soft foods like you did in the beginning?
How long's your
Start
plateau?
over? I haven't really. I'm just curious.
Yeah, that's like a 5-day pouch.
It's like the 5-day pouch test. I love the 5-day pouch
What's
test.
that?
What's that?
Oh gosh. I'll have to bring it to you guys next time. It's actually...
You can look it up online. Put in 5-day pouch.
Just
it'll
type
come
in
up.
5-day pouch test. What it is, it's two days of clear liquids. Then it's a day of soft. Then it's a day of more firm food. And then it's basically regular eating again. And what it does is the days actually, because people do say they're going to do the 5-day pouch test to just make sure that their pouch still works. Do they get full? Do you get full? And I can tell you, you get full. A lot of people don't think that their pouch works. They've said, oh, I've stretched my pouch, I've done this, I've done that. When a lot of times they go back and they start eating, they start with clear liquids and they do the pouch test, they actually find that they get full so easily. But what it is that they're aware of what they're eating. They're aware, and they're eating stuff just like in the stages when they started through surgery.
When you look at the literature, patients who, let's say, are a few years out and lost and regained, or lost but not enough, and you look at their nutritional and look at their psychological and you look at their anatomical, it's often not anatomical. It's either because they're not eating right or their kind of objective is wrong. And when they have done these revisions on these patients, like they put a lap band around the bypass.
So people have had
Oh,
that.
yeah. There is literature on this. And the additional weight loss they get is about 10 or 15%. And over 5 years, that also partially is regained back. So which tells you, no matter what you do, if the person doesn't use the tool well, unfortunately, it can fail. So, so true revisions should be done for potential problems.
When he addressed the issue of people who maybe go for revisions because they haven't met their weight loss goals or they put their weight back on, really a lot of the issue is that they need to start working on their head. And when I mean working on your head, not saying they're crazy, that's not what I mean. But, there's this link between your brain and your stomach. Your brain, a lot of times it's your brain that needs the surgery, not your stomach, because you're head hungry. You're head hungry, and I'll ask some of you guys that are a little further out now. How do you deal with the head hunger? Anybody get head hunger?
Yeah, I'm that way now. I'm full. My stomach is full.
And so what do you do?
About 2 o'clock. Somebody said, let's go eat. I could go eat. I eat real slow, and but I am full. My stomach is full.
But how do you deal with that head hunger when it comes and hits you?
It's hard. Sometimes I don't. Sometimes
So you don't put tons of food in your mouth.
I can't eat a lot.
Yeah.
But I was a grazer before I lost weight. And I don't have a problem in the morning, the afternoon, but I'm tired at night and I sit down to relax, 7 o'clock or whatever, and I want to go in and start grazing. And occasionally I do. And I try to start out with, maybe a couple of carrots or, a string of cheese. And, eventually it might turn to, I keep like 100 pack cookies and, it'll go to that. And, it doesn't happen all the time, but every once in a while and occasionally at 8 o'clock, if I see that it's not going to change, I go to bed. That's the way I do.
So ran away. What about you?
I was actually going to say, that's one thing that I noticed for myself is that if I'm kind of hanging around and vegging on TV, the evening time, and I just haven't put myself to bed, my head will start messing with me. So I really learned that as soon as that happens, obviously I'm not focusing on the show, and I shut everything down and I go to bed. If it's during the daytime, one thing that recently helped me in a recent visit with Dr. Yadegar is that he reminded me I need to spread my protein drink out. I was drinking it like a shake, as like a meal, and finishing it, the whole cup in about 30 minutes. And he said, no, spread it out over about 2 hours. What a difference it has made. I don't find now that I'm like having cravings or I can't wait for that next meal, even though my portions are still very small. That made the biggest difference for me. So I really look forward to having my shake in the morning. I'm driving to work, I drink it, I'm finishing off over time. I'll have my small breakfast, and then I'll have another shake, and it's taking me, and I am not looking for something to snack on.
What about at night? Because a lot of people get that head hunger at night. So have you tried that practice in the evening?
Actually, I have. I do have protein at night, but the one thing that helps me is I go for a walk. I get myself up and moving. I have to, because if I'm just sitting in the house, I'm going to be looking. Those are the old habits that we have to change. Like she keeps saying, this is a tool, this is a tool. We got ourselves to this point because of those habits. So we can make every excuse we want. We can have every possible snack in the house that we think is healthy, but if we're eating, you know, the whole cabinet full, it's not healthy for us. We have to change those habits. And I am so thankful that Kaiser made me go through those education classes. I went through twice because I didn't take it seriously enough the first, how many weeks? 12 weeks?
12 weeks.
You know, so I asked, can I please go back again? And then the second time I really learned so much more, and that's actually when I made the decision to go through with this, because I knew there are too many people, I work in healthcare, there are too many people that fail at this. And the reasons they fail are because they do not take it seriously enough to change those bad behaviors. You have to want to do that.
So how some of your bad behaviors, what other things have you done to help you change your bad behaviors?
Well, I picked up better behaviors. You know, I don't, I DVR shows that I want to watch. So I'm not actually sitting there for, you know, too long of a time. I can watch them really when it's more appropriate, not for 3 hours watching television. Definitely my, you know, my eating habits, watch my protein so that I'm not feeling the hunger, and exercising. I really just found exercising, it not only makes me feel physically better, but it makes me feel mentally better. So, but don't think I don't, you know, mind fuck myself if I may say it that way. My head plays with me every day. Every day it plays with me because I've had these behaviors, these thoughts all my life. So it's not going to change in the last
what am I
year.
going to eat? How is that going to taste?
Oh yeah, definitely. Oh, I feel so deprived when I know that something I used to just love is not going to benefit me today. But you know what? I have grown up enough to change some behaviors that way. You know, I've gotten sick, just stomach pain. I mean, truly, this surgery in itself has forced me to change behaviors because I don't like the way I feel when I don't.
How far out are you again? I can't remember.
6 months.
6 months.
And what's your hospital?
I just thank God that Dr. Yadegar does the surgery.
I'm just over 2 years, and that grazing is something I struggle with off and on.
It comes back, doesn't it?
Yeah, I'll go in sprees. I'll do, you know, a little bit where it's like, okay, you got to get a handle on this, and then I'll be fine. But what I notice I have trouble, as she mentioned the protein, sometimes I'll forget that second protein drink that I should be having. And that's when I start scouring the kitchen saying, what can I eat instead of drinking?
What about, I was just going to say, what about if you don't get enough to drink? Water, your water.
Well, I'm a big water drinker, so I don't normally have a problem not drinking enough water. It's the protein. I'll fill up on water, and then I don't have room for protein, but I sure have room for a little cookie.
Does anybody have any issues with if they don't get enough water that you find that you're more hungry?
Yes. I have a hard time getting all the water because you're supposed to stop 15 minutes before you eat, a half hour after you eat. I set an alarm, I do all, but trying to get 64 ounces of water in is almost impossible.
Remember, if you have some popsicle, that counts.
Right, I do that.
And you count your protein with it too? Yeah.
But I noticed that sometimes I am just honestly thirsty, and my thirsty is a lot more evident now than it was before. And sometimes if I just drink, then I won't be hungry.
Does the water that you add to your protein drink, does that count as protein?
Of course.
Yeah. Oh, heck, I'm
You know, and that 30 minutes is much more important than the 15. It really, the before eating, drinking is not as detrimental as the drinking after eating. So that 30 minutes is really something you have to be cognizant of. The 15 minutes before, you can drink sooner and start eating. As I said, you got to kind of be a bit out of the box. Sometimes you just have to start to be creative.
Yeah, and that's a lot of it. You have to be really, at times, creative with how to make things